All right, guys, so we're going to be talking about time management and prioritization. So this is your next assignment. So when you're in medical school, you're going to find that everything's due at the same time. So, for example, if you find you have, let's say, 4 tests on Friday and there's 3 assignments also due on Friday, you can't just study for all 4 tests and do all 3 assignments on Thursday evening. And so a lot of this is getting back to your current assignments. I notice a lot of people are turning things in. If it's due at 5 p.m. on Friday, people are turning in at 4:59. So why this? I mean, hey, technically it's on time, but why we need to work on this a little bit is because you're preparing for a medical school. And you're going to find out that it's not going to work that way. So let's do a little example. So you have your 4 tests on Friday and your 3 assignments. So you're going to have to break it up. So on Monday, you're going to work on assignment 1, assignment 2, complete it. Bam. Tuesday, you can study for test 1 and test 2. Okay? And then Wednesday, you can study for test 3 and 4. And then Thursday, you can finish the 3rd assignment and then review some of the tests that you studied a few days ago. Like, you simply cannot study for all 4 tests and do 3 assignments on Thursday. So this time management is very important. And what about prioritization? So in medical school, and if you are a current medical student and this sounds familiar to you, comment, because I know that this is something that occurs quite frequently. It is that you have to pick something to fail. And if you're not in medical school yet, you might be like, fail? Well, I will have you know that in college, I got 100% on pretty much every single thing that I did. A's on everything all the time. And then in medical school, like, there were literally tests that I failed. So it's gonna happen. Everybody in medical school is the top of their class. And it is just, I would estimate the amount of literature that you have to review to be about 10 times as much as any analogous test in college as compared to medical school. So that is why I use the word failed, and I mean it, failed. So let's say you have anatomy and physiology. You have a 60% in physiology and an 80% in anatomy, and both the anatomy and physiology tests are on the same day. You may actually opt to fail the anatomy test because your overall grade is an 80, so that you can focus on physiology and end up passing. And that is what is called prioritization, my friends. And it is a very important skill if you're going to go to medical school. Not only medical school, but beyond. You may ask, you know what? Why are the professors making everything due on the same day? That's because your patients are not going to have acute needs. Your patients aren't going to die all in a convenient time frame. People are going to literally be dying at all times simultaneously. You have to prioritize. You have to be able to set aside like certain acuity levels. Who needs to be addressed first? It's a sad realization that when you're a physician, there will be life-threatening critical events happening at the same time. And if you have not practiced, okay, I'm going to have to fail this anatomy test so that I can pass physiology. My anatomy grade will go down, but it'll still be passing. If you haven't learned how to prioritize in that manner, you're not going to learn how to prioritize patient needs when you have 40 patients simultaneously. Now that's a little bit of an exaggeration, but there was a time in residency that I had 40 floor patients in internal medicine as a psych resident by myself for 2 hours where I couldn't get a hold of an attending. And everybody ended up actually doing fine, even the guy with Cauda-Equina syndrome. But I think that was because I learned how to prioritize things in medical school. So that is why it's extremely important. So let's say that you have a patient in room 8 and they're getting pretty hypoglycemic. They need some glucose. But then you have somebody in room 10 who's having a seizure and they need Ativan. But then at the same time, you have somebody who's having a horrible bacterial infection that is just making them septic all of a sudden, and you need to pick which antibiotic you're going to treat them with. And the patients aren't going to wait. They're not going to go, okay, well, I'll have this acute event on Thursday so that he can have his acute event on Friday. No, it will happen at the same time. So it's very important. And so I think that for everybody's benefit, you guys should start doing your assignments during your shifts and turning them in then instead of, 5 minutes before they are in fact due. So to complete this assignment, please hit that you understand during your shift and not at 4:59 p.m. Thank you.